Hi, thank you very much. Welcome to RIPIN's presentation. This evening we have Katie Conti and Ann Fatura from our Parent Training and Information Center at RIPIN. At this time, I'm going to turn the mic over to these ladies. Thank you for joining us this evening.
Hey everybody, my name is Ann Fatura. As Sue said, I'm the manager of the Parent Training Information Center, or the Special Education Program at RIPIN. I've been at RIPIN for a little over 15 years now. Like a lot of other people at RIPIN, I am the mom of a young adult now with a disability, and that's what brought me to RIPIN.
Hi everyone, I'm Katie Conti and I am the supervisor of our special education program here at RIPIN, and I have been here for coming up on 8 years now. And it was actually my work in early childhood that brought me to RIPIN, but it was while I was here that I learned that my daughter had a disability and how to advocate on her behalf and kind of navigate the world of Section 504.
Great. So now we're going to get right into who is RIPIN? So, RIPIN was founded in 1991. So actually we actually have started our 35th year. And it was founded back then by parents who were navigating special education for their own children and running into barriers. There was confusion about rights, difficulty accessing services, and systems that felt overwhelming and isolating. Instead of accepting that reality, they came together to support one another and to push for better outcomes, not just for their own children, but for families across Rhode Island. From the very beginning, RIPIN was built on lived experience, parents helping parents, and that foundation still defines who we are today. Our work has grown over the years, but our purpose remains the same, making complex systems more accessible and ensuring that families don't have to navigate them alone. Sorry. So today, RIPIN is an independent 501c3 nonprofit organization, which allows us to remain community-driven and family-centered in everything we do. One of the things that truly sets RIPIN apart, as I said, is our staff model. Many of our team members are peer professionals, people who have personally navigated the systems that we help others with, whether that's special education, healthcare, disability services, or aging supports. We support Rhode Islanders across the lifespan, from early childhood through older adulthood, and across a wide range of needs and backgrounds. Our role is to help people access, understand, and navigate those complex systems like healthcare, education, healthy aging services, and other public and community supports. We don't replace services. We help people understand their options, advocate for themselves or their loved ones, and make informed choices. And there is a lovely shot from one of our all staffs. We love to get together and we love to eat together. And this is a great big picture of all of us together.
Ann, could you share your screen?
My screen is not sharing?
Nope.
No, it's sharing.
All right.
Can
you see the slide deck? Okay.
Okay. Let's see. Okay. So, let's see. So RIPIN's values. This is a list of our values, and we came up with those values together, I have to say, probably at that all staff that you're seeing a picture of right there. This is how we show up for families and for one another. So at the core of our work is lived experience. We believe that shared experience builds trust, understanding, and meaningful connection. Empowerment is central to our approach. Our goal is not to tell people what to do, but to give them the tools, the knowledge, and the confidence to make decisions that align with their goals. Integrity means we provide accurate information, respect, confidentiality, and remain transparent and accountable in our work. Inclusivity ensures that everyone, regardless of language, culture, ability, or background, can access that support. And finally, collaboration is how we make change happen. Working alongside families, schools, providers, community partners, and systems to create better outcomes together. These values shape our programs, our relationships, and the way we support families every day.
Behind every RIPIN support is real expertise that you can trust. So our staff include professionals with a deep experience in education, healthcare, early childhood, healthy aging, care coordination, and systems navigation. Most importantly, many of us are parents and caregivers ourselves. We have been where you are, and that's why we lead with empathy and not judgment. Whether you need help with your child's IEP, navigating health insurance, managing multiple care systems, or finding balance as a caregiver, we have you covered here at RIPIN. We don't expect you to know where to start. We will walk the journey with you. RIPIN supports people across the lifespan, but today we're focusing primarily on parents and caregivers of children and youth with special healthcare needs. This includes families navigating early childhood, education systems, healthcare, transitions to adulthood, and caregiver wellness. We also support individuals and families invested in healthy aging, whether for themselves or for loved ones, through programs like our Community Health Network, care management, hospital transition, and insurance support. In addition, we work closely with professionals across all populations we serve. While this presentation centers on families with children and youth, it's important to know that RIPIN supports are designed to meet people wherever they are in life. At RIPIN, we understand that families caring for children and youth with special healthcare needs are often navigating both education and health systems at the same time, and these systems don't always communicate well with each other. Our approach is comprehensive and family-centered. We focus on empowering families with knowledge, tools, and support so they can make informed decisions and advocate for their children. We use a team-based model working alongside families to develop individualized plans that reflect their goals and their priorities. That support can include workshops, one-to-one guidance, and connections to our statewide peer network, ensuring continuity of care from infancy through young adulthood.
Okay, so at RIPIN, we believe that language should never prevent anyone from getting support they need. Families come to us at moments that can already feel overwhelming, and clear communication is essential. More than half of our client-facing staff are bilingual and provide direct support in both English and Spanish. For families who speak other languages, we use professional interpretation and translation services to ensure accurate, respectful communication. This means families don't have to rely on children, relatives, or friends to interpret important health or education information. We meet families where they are, in the language they're most comfortable using, so they can fully understand their options, rights, and next steps. Our commitment to language access is part of our broader commitment to equity, dignity, and making sure every family can access care, education, and support that they deserve. So this graphic represents how we think about support at RIPIN. We don't see healthcare, education, caregiver wellness, or community support as separate. They're all connected. The child and family are always at the center, and around them are the systems and supports that impact daily life. Healthcare access, educational success, community resources, and caregiver well-being. And by addressing all of these areas together, we're better able to support positive outcomes for children while also supporting the adults that care for them. And here is across every stage of life, right? Who we support at RIPIN. We have infancy, that early identification and support through developmental screening and early intervention, right? Then into toddlers and preschool years, that guidance for transition into preschool and understanding your child's rights. Elementary age, 5 to 10 years old, support with IEPs or 504 plans and navigating special education system. Preteen years, that's the fun time, empowering families to advocate as needs change and services evolve. Teen years, transition planning for adulthood, what comes after school, including education and healthcare and life skills. And then on to adulthood, connecting those young adults and their families to adult services and self-advocacy tools.
Okay, so the areas of support that include early childhood, special education navigation, healthcare, peer support and caregiver education, multi-generational care, and clinical support. As we go through the next few slides, you're going to see how each area fits together to support the whole child and the whole family. Families may connect with RIPIN at different points in time, depending on their child's age and needs. In early childhood, we support families navigating early intervention, developmental concerns, and those early transitions into preschool and school systems. As children grow, we help families navigate special education services like IEPs, as well as 504 plans, and we provide healthcare support for children with special healthcare needs, including care coordination, peer support, and personalized guidance across systems. So early childhood can be overwhelming, especially when families are first learning about developmental delays, diagnoses, or the early intervention system. RIPIN helps families understand their child's needs and rights, including how to transition from early intervention into preschool supports. We also help families communicate effectively with doctors, therapists, and other providers. Beyond services, we support families in accessing childcare, early learning programs, and benefits like WIC, Right Care, and additional supports, such as SNAP, Katie Beckett, or medical equipment. Just as importantly, we connect families with each other through workshops, home visits, and peer support groups so they don't feel alone.
Okay, and of course, special education, which can feel complex and intimidating. And that's something we hear from families all the time. RIPIN supports families in understanding their rights and working collaboratively with schools. We help families navigate the IEP and 504 process from evaluation through implementation. And we build advocacy skills so families feel confident speaking up for their child. Families can access workshops, trainings, and peer support from parents who have been through the systems themselves. We also support transitions to adult service and provide bilingual assistance and specialized support for military families. Healthcare. So for families of children with special healthcare needs, navigating the healthcare system can be just as challenging as navigating education. RIPIN helps families get and keep health insurance, understand how to use their coverage, and resolve issues when problems arise. We also provide healthcare coordination to help manage appointments, providers, and services across systems. We connect families to wellness programs, community supports, strengthen communication between families and providers, and share information about policy advocacy issues that impact children with special healthcare needs. Okay, should we stop there just to make sure? Is there any questions? Have any questions in the chat yet?
None at this time.
Okay. All right, I'm going to move on to peer support and workshops. So, as we've mentioned a time or two, peer support is at the heart of RIPIN's work. We believe that there is incredible value in learning from people who have lived similar experiences. Families can connect with peer support groups, share experiences, ask questions, and find emotional support from people who truly understand what they're going through. We also offer workshops on parental rights, services, and advocacy, along with wellness programs that help caregivers manage stress, stay healthy, and prevent or manage chronic conditions. Our goal is to help caregivers find balance, build confidence, and feel empowered.
Multi-generational care. Many families we work with are caring for children while also supporting their aging parents or relatives. This sandwich generation faces unique challenges, and RIPIN is here to support the whole family. We provide resources and guidance for older adults and caregivers, including helping managing chronic conditions and navigating complex health systems. Families can learn about Medicare, long-term health care options, and community resources that support aging in place, as well as connect to wellness programs and care coordination for loved ones of all ages. We are also fortunate to have a clinical support team. Behind all of RIPIN's work is our dedicated clinical team that brings a medical and care coordination lens to everything we do. The clinical team helps develop and review care plans for families with complex needs and supports frontline staff with medical guidance and training. Their role ensures that families receive coordinated, person-centered support, whether they're navigating early intervention, special education, complex healthcare needs, or aging services. This clinical
Katie.
expertise, yes.
Oh, I'm so sorry. A question that came up: how long do you work with families?
That's a very good question. So it really varies. It truly is very family centered. And so for one family, they might call and they might have a question, and we'll support them, answer that question, and give them their resources. And that might be it for the time. And maybe we never hear from them again, or maybe they reach out to us years down the road when something else comes up. We might have some other families who maybe need support navigating an issue with their child's IEP team or a bullying concern. And we can support them through that, whether it takes a few weeks or a few months. And then some of our other supports are even longer. So for those families navigating complex systems like education and healthcare all at the same time, we can support those families for months and months at a time. It's really until the family feels that they have what they need to move forward on their own. And families can come back to us at any time as well. Anything you want to add, Anne?
No, that was perfect.
Okay. So I think we could go on to our case studies.
Okay. So now we've talked a lot about all of our programs, right? That's a lot of information that we threw at you. We figure we can talk a little bit about, give you some examples of not real life. These are some examples of what, a call might come in to our call center, which is kind of our hub. That's our main line. Calls come through there, and then they're triaged and sent to the appropriate programs. So here we have our first case study is Noah. And the challenge for Noah, he was born with a congenital heart condition and uses a feeding tube. He's medically fragile and missed a lot of preschool due to hospitalizations. As he enters kindergarten, his parents are overwhelmed and with keeping up with both his medical and educational needs. So what would RIPIN support look like? Well, a care coordinator helped manage communication with multiple specialists and scheduled home-based therapies. A special education coordinator supported the family through the IEP process, ensuring nursing support in school and therapy were included in the school plan. And then the family was connected to peer support groups for emotional support and tips from other parents of medically complex children. So really, the message here is that we don't have to choose between supporting someone with health or education. Really, this parent was able to say that RIPIN helped them with both of those needs. Okay, here's another one. Another example is Layla. So Layla was recently diagnosed with epilepsy, and her seizures and medication were causing her to fall behind in school. And she began to feel isolated from her peers. Her family was also struggling to afford the new medication and was unsure where to turn. So they called RIPIN. And what was RIPIN able to do? Provide education about her medical rights at school, including accommodations under a 504 plan. We were able to help the family request evaluations for learning supports and an updated IEP. And Layla's parents were offered peer-to-peer support and referral to a support group. Also, our call center would be able to answer questions about Layla's new medication and ensure those medications were covered under the family's health insurance plan. So RIPIN helped Layla's parents ensure that Layla was safe and supported at school, even as her health needs changed.
Okay, and so next we have Ava, who has a rare metabolic condition that requires a strict treatment regimen and frequent monitoring. She also has a learning disability that affects her executive functioning, and her parents were worried about how to manage the demands of high school. So RIPIN was able to support the family through the transition-focused IEP meeting to include healthcare planning and classroom accommodations, help the family work with the school nurse and the special education team to implement a school health plan, provided workshops to the parents about preparing for adulthood, and supported Ava in building her self-advocacy skills. And Ava was invited to participate in a youth advisory panel to grow her leadership and self-advocacy skills. So RIPIN was able to provide Ava's parents with the tools they needed to help Ava thrive in high school, as well as help Ava get started on her self-advocacy journey. And Isaiah has autism and anxiety, and he's graduating high school, but his mom isn't sure how to transfer his IEP supports, manage his medical care as an adult, or help him find meaningful next steps. So RIPIN was able to guide the family through the transition to adult services, including SSI, Medicaid, and other healthcare providers, helped Isaiah's parents understand how to work with the College Disability Office to ensure that he could access his education, and connected them to parent and youth resources on supported decision-making. So again, RIPIN was supporting Isaiah's family as he took his first steps into adulthood with a plan that honored his needs and his independence. Okay, and here we have some upcoming events. So we have a session on Medicaid coming up where folks can learn more about Medicaid, as well as a webinar coming up on the differences between IEP plans and 504 plans. And those QR codes will lead you right to the registration if you're interested. And if you can't capture that for any reason, we also have those links available on our website. Okay, and here we have a few more upcoming events. So we have our early childhood folks are doing a presentation, Let's Talk Early Intervention, and that is available in English and Spanish coming up. And again, that QR code will take you right to the registration page. We also have support groups available in English and Spanish, and they meet monthly. Our Spanish support groups have a daytime and an evening. It's like our English one does as well. QR code will take you to the link to register for that. And that's something you can always like come and try it and see if you like it. It's not like mandatory participation, but we would love to have you join us and see if it meets the needs of you and any of your other family members caring for your children.
So our RIPIN resources, across all areas of support, we offer a range of resources through our Learning Center, our online library, and other services that don't necessarily fit neatly into any one category. So we encourage you to take a look at our resource page. They are, if you go to our ripin.org page and you look at how we can help, there is a tab for resources. I'm going to show you on this next page. This is on the left-hand side, you'll see that's our resource page. So when you visit our website, you'll find a range of materials from online webinars to upcoming workshop calendar. Some examples of upcoming offerings across our programs are some of the things that Katie mentioned. But we have, let's see, in March, I think Katie mentioned that we have the IEP versus 504. So that's our next upcoming webinar, and we hope you'll join us for that. Let's see. And these are a few more things that you will find if you bounce around on our webpage. We have our self-directed program, which is for families of individuals who self-direct their supports after school services and for individuals who are eligible and found eligible and are utilizing adult services through behavioral health care, developmental disabilities, and hospitals. We have a program that specifically supports families with those who self-direct their funds. Community health network classes and programs that are offered. And then here is our special education support page. And newsletters. If you sign up for our newsletters, really, we don't overwhelm people with a lot of emails. It's pretty reasonable. So we hope if you do have a chance, you'll get information in your inbox about those upcoming webinars. And here is, let's see, this is the QR code. Let's see.
It's the QR code to sign up for our newsletters if you're interested.
Thank you. Thank you, Katie. I'm going to leave that there for a second because I feel like a lot of times it takes people a second to grab that. And then however, if you don't grab it and I move on too fast, again, you can sign up for newsletters right on our website. And then again, here's all our information that we've been talking about. We do have a conference in March, a self-directed conference. And you can follow us on your preferred social network. Now, do we have any more questions?
Not at this time.
Okay, before I close out, I really would like to leave this up for a moment because I will tell you, as we mentioned at the beginning, we are a nonprofit and we rely on grants from the government, from other agencies. And so we'd like to show them that we are doing what we say we were going to do and that we're trying to do it very well. So we would love to hear from you about what you heard tonight. If there is, if you liked it, if there's anything that we could do better, please let us know and fill out our survey for us. I think someone is going to, if the QR code is not your thing, I think someone is going to pop that link into the chat and you can click on that now. And even if you fill it out afterwards, it should open a window for you and you can fill it out afterwards. But we really appreciate your feedback and we do rely on it greatly. And let's see, again, just for contact information, you can call our call center any day, Monday through Friday, 8 to 5 p.m. At 401-270-0101. You can email us at info@ripin.org. Again, you can go follow us on all the social media and go to our website and visit us there. So before we close out and have everyone say goodbye, I'm going to leave that up there again. If there's no questions, I want to thank you for coming. And reach out to us with any questions directly.